A very good morning to you all. But nevertheless, yes, I just returned from the World Health Assembly, with which, in my view, was one of the most productive World Health Assembly that I've attended. The first one was last year and this year. In comparing both, Fiji led to important discussions in which two resolutions were adopted. One was the climate change and health, and the resolution on strengthening emergency preparedness for disasters during a natural hazard. So again, two very important resolutions that were passed, and two resolutions which in itself carry respective monetary value towards it. So we are very grateful that Fiji participated in as one of the core groups, and also it was adopted. So Fiji, in terms of representing not only the Pacific and the SEEDs, made our voices heard in the World Health Assembly. Again, back to reality in terms of the issue that is before us, and that is I'm told this is the high-level deliberations on transforming primary healthcare in Fiji. The Director of Pacific Technical Support for WHO, representative to the South Pacific, Dr. Mark Jacobs, is not here, and I acknowledge Dr. Atonio. The Ministry of Health Permanent Secretary, Dr. Tundrawu, Development Partners, ladies and gentlemen. It's a great honor to be with you today on this high-level workshop on transforming primary health and care in Fiji. This workshop signifies a critical juncture to review, discuss consolidated information from consultations and assessments, then develop a tangible strategy for transforming primary health care in Fiji. A strengthened primary health care program will ensure that our population receive the health care that they need in a timely manner, fulfilling our universal health coverage targets for Fiji. For the initial National Primary Health Care Workshop, officiated by Honorable Deputy Prime Minister Professor Biman Prasad in early October, last year and up to last month, our primary health care focal points have worked with the divisional and sub-divisional multidisciplinary teams. And on that note, the team from the Ministry of Health had attended our budget consultations in terms of our upcoming budget. And I'll be pleased to tell you that there are some very good initiatives within the budget that will support our primary health care in that space. So looking forward to that on June 28th. They have been supported by WHO and UNICEF and have engaged with communities, asking for their feedback on the current health services and how we can do better as a ministry and as a whole of society. As you may be aware, this is in line with key fundamental of this government's development agenda for inclusive development to improve the well-being of our citizens. As we deliberate a way forward for primary health care in Fiji, we need to gather commitment within cabinet, within government, in other ministries, and from our stakeholders and partners. This includes strengthening forums or platform for engaging with empowering individuals and communities to participate and prove inputs and feedback on health services being delivered. This journey will also require us to strengthen data management and reporting mechanism to determine if our overall goals and health services inputs are meeting targets, and whether the system itself is responsive to the health needs of the people so that it is fit for these times and fit for the future, for our children and coming generations, for our Fiji. While Fiji has made commendable strides in implementing primary health care in the 70s, health outcome indicators signal the need for change. We must strive to enhance comprehensive health services, assess quality and equity of care, particularly in response to Fiji's evolving health needs such as NCD crisis and the rising HIV incidence. Fiji health needs are changing and the non-communicable disease burden growing. Inaction today may result in unsustainable health spending in the future. I am quite convinced of the course of these 2 days, your efforts and commitments to strengthening primary health care services in Fiji will result in the co-creation of a shared path forward, strengthening and partnership and cooperation and forging of new relationships, all to ensure better health services and health outcomes in Fiji. I reiterate the government's unwavering commitment to improving healthcare services across the country. Finally, I will also take this opportunity to express my deep thanks to WHO for funding this workshop. And with these words, ladies and gentlemen, may I wish you all the very best in this 2-day workshop. Thank you.
The Minister of Health and Medical Services, Honorable Dr. Atonio Lalabalavu, the Minister of Health and Medical Service staff, development partners such as World Bank, ladies and gentlemen, Nisambura Banyaka, and also Namaste and good morning. Thank you very much for invitation and a warm welcome to this workshop. WHO representative to the South Pacific and Director of Pacific Technical Support, Dr. Mark Jacobs, regrets being unable to join us today. On behalf of him, the representation, I am indeed honored and privileged to be here today with all of you to deliver opening remarks at this workshop aimed at strengthening primary health care in Fiji. Your presence here today signifies the importance that you and your units and departments place on strengthening primary health care services in Fiji. It also demonstrates your commitment to working together as a team from review process and planning to improve comprehensive health services access, quality and equity of care, considering Fiji's challenging health needs and growing non-communicable disease burden. When primary health care systems are strong, money and lives are saved, and health system works better. When primary health care is well implemented, health systems are more resilient to many things, climate and pandemic and many others. Building and maintaining strong, resilient primary health care requires strong leadership and coordination in addition to clear strategies and systems for review and accountabilities. Strong primary health care also requires investments on spending and policy to ensure availability of skilled primary health care workforce, adequate drugs and supplies and technology, and adequate infrastructure to deliver the services. Strong primary health care also requires a people-centered approach, mechanism for engaging with communities, which is very important, and the promotion of health and disease prevention, and a commitment to not leave anyone behind. This investment will result in significant returns for Fiji. Fiji is making significant progress in a number of health areas. However, Fiji also need, along with the rest of the Pacific, continue to be disproportionately affected by very high rates of NCDs, is suffering from effect of climate change, and is still dealing with communicable disease threats and workforce challenges, which is common for all Pacific Island countries. Because of this, more work is needed, including in primary health care, and this is why we are here today, to deliberate on what we know from the past assessment and the lessons learned and the consultations, and to then determine what success would look like. This is a question for all of us, with tangible key actions and the steps to move forward. As World Health Organization, we stand ready to support Fiji's effort to transform primary health care for the people of the Fiji. I wish you all the best in this 2 days workshop. Thank you very much. Dan Yamba, I hope I pronounce okay, and Binaka Bakalevu. Thank you very much.